My mom was a quadriplegic as a result of not getting a polio vaccine in the 50s. And at the time I was 5, I had 2 younger sisters. One was 10 months old and the other one was 3. And my father found himself raising 3 very small young children with a quadriplegic wife. We ended up being raised on, at the time, what was considered welfare. And I recall the days of needing to go in for health care and being embarrassed by either the way you were approached because you didn't have the means to pay, or the fact that you would get subservient services because you weren't a cash paying or a insurance paying individual. Obviously, it was a motivation to do the right things in terms of education and professional career choices as I grew up, but also left me with a passion to make sure that the underserved didn't have that same experience that I did.
If you can't afford to take your children to the doctor, if you can't afford to take yourself to the doctor, if you can't afford your own medical care, 30 years ago or today, you feel it the same in your heart. Most of the communities were either just being developed or were still in the planning stages. San Juan Community Clinic was in existence for just 2 years in its formation, and it was really struggling to get along economically. And I was a member and on the board of another organization, and came home to my husband one day bragging about our success, and he said, "We really need you to adopt us." I said that I would like to put together an organization that would be independent of his board of directors, but we would answer to them. We would have a voice, but no vote, and vice versa, and he agreed.
Camino Health Center was in a very tiny room as part of the San Juan Capistrano School District, and people were lined out in alleys in the streets trying to come in to get health care. And the auxiliary gained a lot of passion and commitment around raising funds to help them build a health center.
We sold hot dogs in front of Ralph's for the Swallows Day Parade, and it was a really overcast day. It started out very, very cold, and at the end of the day, we made $60. And May Murtis, who's still a member, her husband looked at both of us and said, "Girls, next year let me write the check." The very first fundraiser that we had was a dinner dance, and it was coming on the tails of the 2 that had been already held. We made $13,800. The desire to support us was there, and the willingness of the people to work on it was there, and so that we had something really strong to grow from.
Part of our funding was to try to keep services that can be primary care into the clinic and out of the emergency rooms at the hospital. So often members of our auxiliary are actually individuals who have been in the emergency room and have the same passion around not having to wait so long for services, or understand the need to continue to have an emergency department that can support trauma cases and critical cases.
I've been in the hospital before, and I see what goes on in the emergency room and instances with my child that had croup, and how critical it is in the emergency room and how short time the doctors have. And so my goal is to keep small cases out of the emergency room at Mission Hospital, and people in the community know they can go to Camino Health Center and get care.
It is our mission to take care of those who do not have access to medical care, who would otherwise be unable to secure it. In the past, this has involved people that were largely uninsured. In today's world, it also involves those that are underinsured. We would not exist without the support that we receive from the community, both in terms of direct donations to the clinic, financial support, but also because of the support we receive from the local medical community. And that's really the niche that Camino has always fit.
There are 70,000 people on the poverty level in South County. Camino sees approximately 12,000 of those patients every year, and 20% of that is here in San Clemente. So it was very important that they needed a second location. And part of the auxiliary's job is to help make additional funds and to fill in the voids.
When you are reading things in the newspaper, it's skewed, but when you're at ground level, you really do understand what is going on and what really our community needs and how we can provide services and many different services for the people in our community, whether it's prenatal care, dental, up to senior care.
A very exciting development that has occurred at Camino over the last couple of years has been the development of a behavioral health program. Fortunately now, we are able to say that we have access to a psychiatrist who sees patients here at our facility through telemedicine 4 hours a week and is able to provide us with expert psychiatric consultation. Additionally, in the last year, we have added the behavioral health specialists who are able to acutely assess patients with mental health issues and assist them with referral into appropriate counseling. This represents a significant change in the level of services that Camino is set to offer.
How critical it is for our children, for our youth, for our teens, and for adults, and also for the whole family to have access to a program that can help them get through the hard times that they might be going through.
The fact that we are 30 years old, have seen over 1 million patient visits, and have raised in excess of $6 million is amazing.
I believe I'm most proud of the camaraderie that our auxiliary has, the wonderful friends that I've made over the years through the auxiliary that are long-term relations. I mean, it's just wonderful to have good, strong ties to very like-minded women.
We can't sit by and watch. We have to be part of the cause to make this world a better place. And what better place to start than this Camino Health Auxiliary, this group of women that make a huge difference for so many.
Taking care of our community, building a healthy community, healthy families, is still here and a success. And it is bigger, more successful, reaches more people, provides more care than I could have ever dreamed.
When I arrived in Orange County, I really didn't think that I was going to find a situation where I could take care of the poor and underserved. I was pleasantly surprised because I found that while I had arrived at a county that did not have government support for primary care, I found myself in the unique position of looking at a health center that counted on the support of an auxiliary, that look at my patients. They don't look through my patients. And they see who my patients are. And that's the help that they provide. Without the auxiliary, I could not take care of my patients.